Many of the Atrium Health hospitals have earned the title of Baby-Friendly Hospital, an honor awarded through years of hard work, education, and protocols. Many of these protocols are based on the 10 steps to successful breastfeeding set by UNICEF and the World Health Organization for an optimal level of care for infant feeding and mother-baby bonding. Our goal at Atrium Health is to educate expectant parents like you about the benefits for both mother and baby and the risks of not breastfeeding, so that you can make an informed decision in a safe, non-judgmental place on how to best feed your baby. As a system, Atrium Health maternity centers support, protect, and promote breastfeeding. Your maternity team has received training in breastfeeding support and management. We are here to help you get off to the best start with breastfeeding. Knowledge is key, so consider taking a breastfeeding class to both educate yourself and know what to expect. At Atrium Health, we offer breastfeeding education classes that start as early as the first trimester. Check with your local OBGYN to find a class convenient for you. Next, find a support person. This could be a family member, friend, partner, or support group to encourage you through your pregnancy and delivery. From delivery prep to setting up a nursery and everything in between, this critical support will help you immensely when you need it. Once baby is born at an Atrium Health hospital, mothers and babies stay together 24 hours a day unless a medical reason requires them to be separated. Staying together allows parents to respond to their baby's needs faster and help increase confidence in caring for your newborn. Frequent skin-to-skin contact is encouraged. Hold baby unswaddled to your bare chest to allow baby to bond with you. Even your partner can take part in this very special activity. It's especially important to perform skin-to-skin as soon after birth as possible. Mothers, offer your breast every time you see feeding cues. Don't worry about running out. The more you breastfeed, the more milk you'll make. Watch your baby, not the clock. Feeding should not be scheduled, timed, or spaced. Feed every time the baby shows cues. Let your baby be the guide. Nurses and lactation consultants are on hand to help you understand your milk supply and help with breastfeeding and latching. Achieving a good latch is important and helps prevent sore nipples. It may take a couple weeks to feel comfortable. If medical risk factors for breastfeeding complications are present, a nurse or lactation consultant may encourage you to use a breast pump and teach you how to hand express your milk. Avoid using a pacifier until breastfeeding becomes the norm and baby has gained back to birth weight. Pacifiers mask feeding cues, and more time spent at the breast means more milk later. Artificial nipples such as bottle nipple or pacifier may interfere with breastfeeding. Milk flow from an artificial nipple is faster and easier for baby and may make switching from breast to artificial nipple more difficult. Avoid giving anything other than mother's milk unless medically indicated by your baby's doctor. Mother's breast milk is all your baby needs. Mother's milk in the early days is colostrum, a thick, honey-like texture of small volume, 1 to 2 teaspoons per feeding. Colostrum is full of antibodies and perfectly matches your baby's small tummy size. It is normal and expected to have small volumes of colostrum for the first 3 to 5 days after baby is born. The more you put your baby to breast, the more milk is removed and the faster your body will transition into making mature milk that is higher in volume and thinner in consistency. Mature milk is easier to pump out with a mechanical breast pump. You may find hand expression is more effective than breast pumping to remove the small amounts of thick colostrum. This is a lot of information, but an important thing to remember is to trust the process and keep things simple. Whether you choose to breastfeed or not, the facilities at Atrium Health Breastfeeding Friendly Maternity Centers are here to support you every step of the way.